This week's Ask Dr. Dury is about the role of second autologous stem cell transplants. And again, this is actually quite an important question, especially right now where there are options of so many newer therapies and novel combinations. And the questionnaire asks, what is the role of using a second autologous stem cell transplant versus sticking with just using various newer combinations? And this is a very timely question because the International Myeloma Working Group has just been reviewing this exact topic. And Dr. Sergio Giralt, the principal investigator of this new guideline that we have developed, has brought together experts to come up with some consensus statements about the role of second transplants. And this guideline paper is about to be published in the Journal of Blood and Bone Marrow Transplant, and is a very, very important guideline that will summarize in a very clear way the approaches to the use of second stem cell transplant. And so in the case of this particular questioner, what about stem cell transplant versus the newer therapies? Well, in one of the guideline statements, it's very clear that the consensus is that definitely stem cell transplant should be considered if there has been at least an 18-month remission with a first stem cell transplant. And I can tell you, because I was present at many of the discussions coming up with these guidelines, that there were discussions about how long did the first remission have to be to have a strong recommendation for the value of a second transplant. And I would say that some of the investigators felt that maybe even a one-year remission could be good enough to justify value with a second transplant. Others were more conservative and said, well, maybe we need to look at maybe a 2-year remission as the cutoff for value. But what was very clear is that there is a strong understanding that second transplants are really a valuable option and can give significant remissions. Unfortunately, we do not have a lot of really strong statistical data on this point. There is one recent randomized study where half of the patients got traditional therapy, actually Cytoxan was used as a relapse therapy versus the stem cell transplant. And in that setting, the stem cell transplant patients did better. This was a study conducted by Dr. Gordon Cook in the United Kingdom. And clearly, additional studies are required. But no doubt that stem cell transplant needs to be re-looked at in this kind of a way as a valuable approach to achieve a remission. And also, a second point in the guidelines was that the transplant can be used as a bridging procedure. Many times patients who have gone through a lot of therapies have very poor blood count levels, low levels of white cells, low levels of platelets. And so the transplant can recoup those blood levels, and so that there can be a benefit from the transplant, but also a better achievement of good blood count levels after the transplant so that other novel approaches to treatment can be used thereafter. So a clear answer, yes, to this question. We need to look closely at the role of stem cell transplant, something to discuss carefully with your doctor if you've a relapse situation and you have an option to consider some new therapy or maybe consider a second transplant. So very important to consider for the future.